Now, when we hear about the big C, we often think about persons, but we don't think about animals. This morning, we are talking about cancer awareness in animals, and we are having that conversation right here on set with Dr. Todd Denoon. Good morning and welcome.
Good morning, Shenell. Good morning, Tobago. And of course, I'd like to take this opportunity to say hi, especially to those who have lost ones to breast cancer, those who have been fighting and have won, those who are still fighting, and more specifically to my area of expertise, those who, of course, have been affected by cancer in your very precious patients and pets, and those who have lost, those who've survived. Take this opportunity, of course, to send you strength and to send you a good morning.
Excellent. So, Dr. Denoon, in your capacity as veterinary surgeon at the Tobago Animal Hospital, how often or how frequent would you see pet patients with cancer?
Right. So even before we jump into that, I think one of the most important experiences that I have is when we're at a consult and someone comes in and there's this strange thing on their animal and we decide, and we mention that it could be cancer. We often hear pets get cancer, and very much so. Animals do get cancer, and it's very important for us to distinguish that cancer in itself is not a specific disease. It is a situation where we have abnormal growth of cells, and those cells can be, that sort of abnormality could be that they're growing more frequently, they're growing in an abnormal place, abnormal rate, and just generally abnormally. And that situation can lead to a myriad of various presentations and complications. So in terms of breast cancer specifically, or in veterinary medicine, it will be called mammary tumors or mammary cancer. We're speaking more specifically to cats and dogs because they comprise a vast majority of pets within homes. So within the canine population, breast cancer accounts for the number one most frequently diagnosed cancer in female dogs, whereas about 70% of tumors in cats or female cats would be represented by breast cancer. So it's about the third most frequent in cats, but it's the number one in female dogs.
All right, good to know. But when I talk about frequency of seeing actual patients here in Tobago, is it something that you see quite often?
Yes. So our practice mainly comprises of dogs. When you look at the two, so breast cancers or tumors are very, very common in dogs. And that is for a number of reasons. There are a number of risk factors involved. So in terms of the numbers in Tobago, it is primarily because of how many people own dogs. But in terms of risk factors, you have reproductive status being one of the main functions or main influences of cancer occurrences. So breast cancer is ultimately hormonally influenced. So if your pet is not spayed, you have a higher risk of them having breast cancer. And of course, when we talk about cancer, the main sort of categorizations that are going to be sort of important to you beyond the type of cancer, because again, we mentioned cancer could happen in multiple places, but specific to breast cancer, in this conversation, you're looking at whether it's malignant or whether it's benign. So malignant cancers are the ones that spread, they invade tissues, they cause a lot more complications, whereas benign cancers are just there, easily dealt with. Surgery is generally really effective. They don't really cause a lot of problems unless they're in a really sort of compromising area. But malignant cancers are the ones that you really want to be very mindful of.
Okay, and there are several signs that one can notice on their animals, specifically their dogs or their cats, that can be key indicators that that animal has cancer. What are those?
Right, so cancer shows up as a lump or a mass on the breasts or associated to the breasts. So for cats and dogs, their breast or their mammary tissues are under, well, they're four-legged animals, so it'll be on their ventrum, or their chest and stomach. So if you're seeing any sort of lump, any sort of hardness, if you're looking at either maybe some ulcerations, any of those abnormalities is something that you should get checked out. All right. And that sort of underscores the importance of a regular checking in at your vet. So a lot of times the masses may not be very obvious. So when you come into a vet, your physical exam, the animal, we palpate, we feel, especially if there's a female dog or cat that we know hasn't been spayed, we check the mammaries to make sure that everything feels okay. All right, so the main thing would generally be that there is some sort of visible mass. Of course, with different cancers, they may not always be external. So of course, regular screenings like blood work, etc., may be important for earlier detection.
Okay, and is this similar to human nature, whereby the cancers can be hereditary, or is it based on particular conditions that can cause cancer in the animals?
Right, so we go back to our risk factors. So there are about 3 main risk factors for cancer occurrences. So not necessarily hereditary. So if you have a mother that has breast cancer, the chances may not necessarily be high for the daughter. But again, predominantly in terms of genetics, you have certain breeds that are predisposed to cancer. So in dogs, those will be German Shepherds, your poodles, your Dachshunds, your Yorkies. Those have a higher occurrence of breast cancer than other breeds of dogs. In terms of cats, you have your Siamese and your Persians. Siamese tend to have a higher rate of malignant cancers, whereas Persians tend to have a higher rate of benign cancers. And it's important to note in terms of that distinction that in dogs, about 50% of or cancers or mammary tumors tend to be malignant. And of those 50% of those tend to spread. In cats, however, the situation is much different. About 80% of tumors, mammary tumors in cats tend to be malignant. So if you have any sort of abnormal lumps, etc., in your cats, definitely come in as soon as possible.
Excellent. And outside of cancers, what are some frequent diseases that you often see in animals locally?
So I would say a lot of times it's more infectious diseases. Tick fever is very common, primarily because of how common ticks are, and of course the sort of lack of comprehensive tick and flea prevention. All right, you have leptospirosis, which tends to be an issue during rainy season. And of course, you have sometimes a lot more of trauma because dogs tend not to be well kept. So you have freedom yards uncontained, so you have accidents, etc. happening.
All right, excellent. And even as a pet owner, how can one, try their best to, I know you said that those consistent screenings, coming into the vet and possibly doing the blood work, but what can we do for our pets to ensure that they stay safe and they are healthy?
Right. So again, annual checkups are important. So if you have a puppy, your first things that you would be doing would be your puppy vaccinations, which are generally from 2 months to 4 months, and we do monthly vaccinations. After 4 months, when you have your final puppy vaccine, the next due or vaccine due would be in a year's time. So when you come in, you have the option of doing those blood works, especially as your pet ages, they become a lot more important. So physical exam every year, blood work every year or every other year. If your animal is healthy, of course, if there are other issues going on, you may need to be screened more or check in more often. Beyond that, proper nutrition is going to be very important. Nutrition actually plays a protective role in breast cancers in dogs. So the leaner your body condition is, or your dog's body condition is, it's somewhat more protective. That isn't necessarily seen in cats. So proper nutrition, that would be a chow or a really balanced diet. I would advocate for chow because most of us aren't animal nutritionists. And when we cook for taste, not necessarily for nutritional balance.
Right.
Parasite control, so that would be your monthly deworming with any medication that has ivermectin, particularly so you prevent heartworm, your external parasite control, so your fleas and your ticks, and of course, adequate animal husbandry. So that is making sure that they are sheltered well, they have adequate water, they have, for the breed, an environment that caters to their specific functions. All right.
Excellent. Now we're going to take a quick break right here and we'll be back as we continue more of this conversation. See you soon.
It's a brand new morning, rise up to a brand new dawning as the passion starter. Tobago updates. Na, 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 na. Good morning, Tobago. Na, 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 na.
Good morning, and welcome back to Good Morning Tobago right here on Tobago Updates. If you're just joining us, I have been chatting with Dr. Denoon, who is the veterinary surgeon at the Tobago Animal Hospital. Now, this morning we have been chatting about cancer awareness in animals, and we've been focusing a bit on cats and dogs. But this morning we want to also touch a bit on the diagnosis. How are these animals diagnosed with cancer?
Right. So again, first is the suspicion of cancer. Animal comes in with swelling that is either close to or in the actual breast. So usually around the nipple or maybe off to the side. So if you have a case like that, then the first thing to do is try to determine what it is. Of course, the breasts or the mammary tissues are a meeting of a number of different tissues. So you could have the skin there, and of course, if there's a mass there, it could be just a skin tumor versus something that is a bit deeper. It might be, again, another type of tumor. So ultimately, the first step in diagnosis is getting screened. After that, you have the option of doing a biopsy. So either that may be a small slice of the tumor, or you may choose to do an operation to remove the tumor all in, as one and send that for histology. And what histopathology is you look at the tissue and you look at the cells in the tissue and how it makes and how is it made up, and that could give you the type of cancer. So again, just like cancer is not a specific disease, breast cancer or mammary tumor is not a specific disease. There are a number of different tumors or a number of different cancers that comprise breast cancer because there are a number of different tissues that come together to have the functioning lactation system in an animal. All right. So when an animal comes in, again, we're going back to dogs, about 50% of those are generally benign. 50% of them are malignant. However, so depending on how many tumors you find, that will sort of inform the type of surgery that you do. And those surgeries would be either a lumpectomy, so those are very small masses, where you could just cut around and take out that mass and everything generally is still left intact. And that is if the mass is not associated with the actual gland, so very close to or under the nipple. If it is associated with the gland, then you're looking at a mammectomy, so you take out that one gland. If there are multiple tumors involving different glands, so in a dog, you have about 5 different pairs of nipples, and cats around the same amount. So you're looking at either doing a regional mastectomy, so you remove the 2 closest ones, maybe in one side, one place and one place, or if it's a lung, you may take out the entire chain. Mm-hmm. All right. So that's in dogs because again, dogs have a much more variable prognosis, being benign versus malignant. However, with the fact that cats tend to have a large amount of malignant when a cat is diagnosed, it is usually a full-on removal of the chain. So we remove all the tissue, and that is usually done in a two-step process. We remove all the mammary tissue on one side, close it up, and within 2 to 4 months, or at some point in time later in veterinary medicine, a lot of times surgeries are limited by the ability of the owner to pay for those surgeries. So we try to meet in the middle. So you do one side and then you do the other side, because of course, removing that much tissue is going to make it a lot more harder to close. All right, so dogs, again, you have a number of different approaches. And of course, the aim is to remove the minimal amount of tissue that is required. So around the tissue and clean margins.
Does that reduce the ability of those pets to reproduce after those surgeries?
So I would say, because cancers tend to occur in older animals, reproduction tends not to be a higher priority for the owners or the animal at that point in time. But if you do have a reduced number of mammary glands, then that can compromise your ability to nurse any further litters. But as I said, because breast cancers are hormonally influenced, having your pet spayed around that diagnosis is going to be also important. So again, older animals tend to have cancers. If your animal isn't spayed, that is something that you should definitely look into.
Okay, and we spoke extensively about how one would, remove tissue to test to have that accurate diagnosis. But when it is malignant, how is that treated?
Right. So with malignant tumors, you'll be looking at removing a lot more tissue. So most times you have the gland, then you have the connective tissue, and then you have that layer of connective tissue that is over the muscle. So with malignant tumors, you would be removing all the way down, perhaps down to that connective tissue over the muscle. So you remove a lot more tissue. But if it is malignant, then you may have to go to an oncologist to have chemotherapy done. Again, so the information will be based on that accurate diagnosis. Is this cancer likely to metastasize or spread? Is it really going to be curative, if surgery is going to be curative alone? Because some cancers, once you remove it, that's it. So based on that, based on the accurate diagnosis, you know what the next steps are. And in terms of diagnosis, the other thing that you're going to be doing is staging. So that is going to be looking at the tumor, the associated lymph nodes, and then we're going to be doing radiographs and ultrasound of the chest and abdomen. Because again, malignant tumors tend to spread. So we're looking at for evidence of spread in the lungs, in the liver, and the lymph nodes. So those are the primary site for spread in breast cancers.
All right. And if it is benign, you just leave it, or you just remove it at the hospital?
So if it's benign, we remove it. And again, the animal is going to be fine thereafter, because again, removing a benign tumor, again, much less complicated. And a lot of times with a benign tumor, it can still grow and cause complications because it's taking up space, not necessarily because it's taking up a lot of energy, resources, etc., but it may cause other complications. So
right, because it may be leaning on vital organs.
It might be growing, and that kind of stuff. And it may be getting bruised because it's hanging down versus the others. So surgical treatment is the gold standard, starting for any cancer diagnosis and treatment.
Right, and based on how it, or the stage of it, that's when you decide whether or not you would do chemo.
Yes. So chemo would again be based on the type of cancer, if there's spread, and of course, accurate staging.
Excellent. And finally, when we look at risk reduction strategies for pet owners, what do you recommend?
Right. So going back to something that we've mentioned a number of times, breast cancers are hormonally influenced. So you would want to spay your animals. That is now a little bit more complicated. because previously we would have always advocated for very early spaying in dogs and cats to prevent. So that's based on a 1969 study, so fairly old, where in dogs they showed that spaying before the first heat has a rate of cancer occurrence of maybe about 0.5%. And then between the next heat, about 8%, and by the third heat and older, around 24%. And beyond that, it tends not to have any protective effect. And that's specifically in dogs. But when we reviewed the literature, there was certain amount of, the evidence wasn't as strong, and there was a lot of bias because, of course, when you're looking at pet populations, particularly in cats and dogs, a major social pressure is the overpopulation of pets. So, of course, as a vet, you don't specifically deal with cancer, you deal with the whole patient, you deal with the pet population. So that could have influenced the decision for when it should be done. Additionally, with larger breed dogs, because hormones affect the closure of bone growth plates, you tend to have a lot of issues if you neuter them or spay them too early. So you have bone abnormalities, you have certain cancers now becoming more likely. So what do we do? So again, you may have to look at the risks involved. Do you plan to have litters from this female and have a structured breeding plan and then spay your animals? So even if you decide not to spay, the reality is the older the animal gets, the more exposed to hormone therapy, hormone influences, older dogs tend to get cancers more likely than spayed older animals. So at some point in time, you should look towards spaying your dogs. However, that sort of protective mechanism in spaying in cats is a lot stronger. So if you have a cat, definitely spay and neuter very early, because again, the situation is very different with cats. Having a higher amount of malignant tumors and a higher occurrence, you would want to, the risk there is higher. So besides hormonal influences, spaying your pets, you're looking at body condition, you're looking at breeds, and of course, you're also looking at hormonal therapy. Some certain conditions require the use of hormones. So if your animal is one of those patients, then you're going to have to look at the possibility of breast cancer being happening at some point in time. And again, very interestingly, and also reflected in human medicine, male breast cancer is also seen in dogs. And just like in humans, about 1% of all breast cancer diagnoses are male in dogs as well.
Excellent. Well, we want to thank you for, bringing this information to light. And persons can contact you at the Tobago Animal Hospital, just to get their dogs checked and to ensure that everything is okay.
Yes.
And so again, thanks for coming in this morning. And I always look forward to chatting with you and learning more about what's happening with our pets. Guys, we're going to take a quick break right here and we're going to be back with lots more conversation right after this. See you soon.
Go.